Ever wish you had like an extra pair of hands in the clinic?
Oh, totally.
Or maybe a super efficient assistant who could just like, whip up a discharge summary in a flash.
Yeah.
That's the kind of power that AI is starting to bring to obstetrics, like right here in India.
It is. It's really amazing. And this deep dive is basically your guide to like getting started with all this.
Yeah.
We've got insights from some real experts, Dr. Gaurav Gupta and Prakash.
Yeah.
Both of them are really strong advocates for integrating AI into medicine.
Yeah, for sure.
And you know what they both say?
100%.
This isn't about replacing doctors,
right?
But about giving doctors these incredibly powerful tools to enhance their practice.
It's like having a tireless resident, right?
Exactly.
Always ready to help.
Yeah.
Doesn't need coffee breaks or sleep.
Right, exactly. Like, think about all those detailed discharge summaries you have to write.
Yeah.
Instead of spending hours, writing those yourself.
Yeah.
Imagine just using AI to generate them straight from your patient notes.
Okay, that sounds amazing in theory.
It really is.
But how practical is it really?
Well,
can AI really capture all those little details of a patient's case?
Dr. Gupta actually suggests trying this out yourself.
Oh, really?
Yeah, take photos of your case files, obviously without any identifying information.
Of course, yeah.
And use that as input for ChatGPT.
Oh, wow.
It's really effective.
Really?
Yeah, you can get a full summary in just seconds.
That's amazing. Okay, so that's discharge summaries. But what about, patient communication?
Right.
I mean, we all know how important that is.
Absolutely.
Especially in a diverse country like India.
Yeah, so imagine being able to create, personalized patient handouts.
Okay.
In different languages.
Yeah.
Tailored to their specific needs.
That would be incredible.
Dr. Gupta actually gives the example of, generating a diet chart for, say, an 8-year-old gymnast.
Okay.
And you can even choose the language. So say you want it in Punjabi. You can make it super accessible for the family.
That would definitely help patients understand everything so much better.
Right, and that leads to better compliance.
For sure.
Yeah.
Okay, so we're talking about AI helping us save time.
Yeah.
Improve accuracy.
Yeah.
Enhance communication.
Exactly.
So much to love.
Right.
But for someone who's totally new to AI,
yeah,
where do they even start?
Well, Dr. Gupta has a call to action.
Okay, I like
a simple 3-level approach.
Okay, so level 1.
Level 1 is simple download ChatGPT.
Okay.
It's free and just start experimenting, generate summaries.
Okay.
Play around with it, see what it can do.
Sounds easy enough.
What about level 2?
Level 2 is connecting with your peers.
Okay.
There are so many doctor-focused AI groups.
Oh, wow.
On WhatsApp.
Okay.
Join one of those and you can learn from other people's experiences.
So it's like a support group.
Basically, yeah.
For your AI journey.
I love it.
Okay. And level 3?
Level 3 is for those who are ready to dive in,
okay,
a bit deeper.
Take some online courses.
Are there good ones out there?
Oh, yeah. Dr. Gupta recommends Stanford University on Coursera.
Oh, wow.
They have fantastic programs on AI in healthcare.
So no matter where you are, just dipping your toes or diving head first, there's a path for you.
Exactly. And it's all about taking those little steps.
Yeah, just those baby steps.
And remember, this isn't about becoming an expert overnight.
Right.
It's about integrating AI into your practice,
Yeah.
at a pace that feels good for you.
That makes sense.
The key is to start exploring.
Yeah.
And see how AI can empower you to be even better for your patients.
It really does sound like it can be that extra set of hands we all wish we had.
Right.
It's like having this super efficient multilingual assistant.
And they never get tired.
Right.
And they're always ready to help.
Maybe AI can even handle those late night social media posts for us.
I wouldn't count on it.
Yeah, probably not.
Yeah.
But the possibilities really are exciting.
They really are.
Yeah, I'm starting to feel that AI excitement myself. But let's move on to how this technology is changing the game, specifically in perinatal medicine.
Okay, that's where it gets really fascinating.
Okay.
We're going to be talking about using AI for all sorts of things, like analyzing ultrasound images.
Oh, wow.
And predicting risks during labor and delivery.
Okay.
Get ready to be amazed by how AI is taking perinatal care to a whole new level.
All right, let's do it.
Okay, so let's talk perinatal medicine.
Okay.
One of the earliest and most impactful applications of AI in this field is in analyzing ultrasound images.
Oh, really?
Yeah. You know those kind of grainy black and white pictures?
Yeah.
AI can actually help us see those in a whole new light.
So instead of just looking at shapes, AI can actually interpret the images.
Yeah.
Wow.
Exactly. There's this system called PAICS.
PAICS.
Yeah, it stands for Prenatal Ultrasound Diagnosis, Artificial Intelligence Conduct System.
Okay, that's a mouthful.
It is, It's been trained on this huge data set of ultrasound images.
Okay.
And it's incredibly accurate at detecting fetal intracranial abnormalities.
So it's like having a second opinion from a specialized expert.
Right.
But like right there in the room with you.
Yeah, even better.
Wow.
Studies show that PAICS can analyze these images so much faster.
Really?
Yeah, than a human sonographer.
And it's just as accurate.
And without compromising accuracy.
Wow, that's incredible.
Yeah.
Especially in those critical moments, you know, when every second counts.
Exactly.
That could be a real game changer.
It really could.
Okay, so speaking of like time-sensitive decisions, what about AI's role in predicting risks during labor and delivery?
That's another area where AI is making some serious progress.
Okay.
Researchers have actually developed these machine learning algorithms that can predict risks associated with different aspects of labor and delivery.
Like what kind of risks?
Well, one example is an algorithm created by Lipschutz.
Lipschutz.
Yeah, it assesses the likelihood of a successful vaginal birth after a cesarean section.
Oh, wow. So it can help us decide if a VBAC is a good option.
Exactly. It's super valuable information for doctors and for patients.
Yeah, that could really help guide decision-making.
Yeah, and potentially reduce the number of unnecessary C-sections.
Right, exactly. That's amazing. And AI can predict other things too, right?
Oh, yeah. It goes way beyond VBACs.
Yeah.
Think about predicting the mode of delivery.
Okay, so like whether it's vaginal or cesarean.
Exactly. AI systems are being developed to analyze all sorts of factors, like, you know, cervix dilation and stage of labor to predict the most likely outcome.
And how accurate are they?
The accuracy rates are really impressive.
Really?
They often exceed like 80%.
Wow, that's really high.
It is. It's a really powerful tool for anticipating potential challenges, you know?
Yeah.
And preparing for the best outcome.
That's incredible. Okay, but what about tailoring care to individual patients?
Right.
Can AI help with that too?
Absolutely. Personalized medicine is like one of AI's biggest strengths.
Really? How so?
Well, by analyzing things like a patient's medical history, genetic factors, real-time health data, AI can help create these really individualized care plans.
So it's like having a personalized medical concierge.
Kind of.
For every expectant mother. I love it.
It is pretty cool.
Yeah.
And these plans can include recommendations for all kinds of things.
Like what?
Diet, exercise, mental health support.
Okay.
And of course, you know, medical interventions.
So it's really about taking that holistic approach.
Exactly. Empowering each patient with the best possible plan for their unique situation.
I love that. This all sounds so incredible.
It is pretty exciting.
It is. But let's talk about something else that's been generating a lot of buzz lately.
Okay.
Smart clinics.
Yeah.
What exactly are those?
Okay, so imagine a clinic where technology is like seamlessly integrated into every single aspect of care.
Wow.
That's basically a smart clinic.
Okay.
They use AI algorithms and real-time patient data to create these personalized health recommendations.
So it's like having a digital health coach, right?
Yeah, exactly.
Guiding you every step of the way.
Right.
That sounds amazing.
It is. And they're designed to be super secure.
Okay, good.
And seamless. You know, they integrate with existing healthcare systems.
Yeah.
And they stick to all the data privacy regulations.
So my data is safe.
Absolutely. All your medical records, your test results, everything is accessible through this user-friendly platform.
That sounds very efficient.
It is. It empowers both you and your doctor with all the information you need.
I like it. So how is AI actually being used in these smart clinics?
Well, for one, they often use AI-powered chatbots.
Chatbots.
Yeah, for scheduling appointments, answering FAQs, and even providing like basic health advice.
So a patient could basically get answers to their questions anytime?
Exactly, 24/7.
Wow.
Without having to wait for office hours.
That would free up a lot of time for everyone.
Exactly. And remember those personalized care plans we talked about?
Yeah.
Smart clinics take those to a whole new level.
Oh, really? How so?
Well, AI can analyze real-time data from wearable devices. You know, it can monitor vital signs, even provide feedback on medication adherence.
Wow.
This allows for proactive interventions and better management of chronic conditions.
So it's not just about convenience.
Right.
It's about actually improving patient outcomes.
Exactly.
That's incredible. And to make things even easier.
Yeah.
A lot of smart clinics are developing their own mobile apps.
Oh, yeah. A lot of them.
So patients can schedule appointments. Access their records.
Yeah.
Communicate with their doctors.
Exactly.
All through their phone.
All from their phone.
That's really cool.
It is. It really puts patients in control of their health care.
Totally. And research shows that integrating telehealth